Good morning. My name is Alec Joe. Can you say your name for the record, please?
Good morning, Alec. My name is Emily Brown.
And what is your candidate number, please?
My candidate number is 251124450.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes. Correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed, and is a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you handle a patient who constantly complains about pain?
In this situation, I would take the following course of action. Firstly, I would bring this concern to the attending doctor and make sure that the patient's pain was being managed in the most effective way. Secondly, I would reassure the patient that everything possible was being done to alleviate their discomfort. And third, I would listen sympathetically to their complaint, reassure them that their concerns were being heard, and that we were doing everything possible to help them.
How have your clinical rotations prepared you for a nursing career?
At Medical Careers Institute, I experienced an externship in Mihiraa Private Limited, which gave me the hands-on experience with patients I need in order to make a difference on day one of my new career.
Do you have surgical experience?
I have worked in different areas of the OR and have a variety of experiences in the surgical setting. I worked as a scrub nurse, prepping the operating room for upcoming surgeries, and helping to monitor patients during surgery. I also worked as a circulating nurse, for a short period of time. My last position was RN First Assistant, in which I assisted during surgical procedures. Most of my experience was with orthopedic surgeries, although I have some experience working in the ER.
Talk about a time when you handled a high-stress situation calmly and effectively.
I was working a shift during which we were short-staffed and had high volume of scheduled surgeries. I had to assist with multiple surgeries at the same time, which was very stressful. I kept an open line of communication going with the doctors, and focused on staying detail-oriented. And focused on each surgery at hand. It was a long day, but everything went smoothly.
What personality traits do you have that goes well with this profession?
Nursing is not an easy profession due to many reasons. Working under pressure and sometimes having to deal with complex patients. The personality traits required are compassion, attention to detail, and patience. And I'm proud to say that I possess these qualities.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning. I am Emily Brown, one of the charge nurses in the hospital. May I confirm your name, please?
Hi, good morning, Emily. My name is Alec Joe.
Hi, Alec. How are you feeling today?
Well, I feel a bit nervous and desperate.
I'm so sorry to hear that. I can understand your situation, Alec. We are here to help you. Always hope for the best.
Yeah, that's correct.
You are admitted to the hospital with liver cirrhosis, right?
Yes, that's right.
I am here today to collect information about you. If you don't mind, Shall I ask you some questions?
Yes, sure. You may please.
Thank you, Alec. First, I would like to know about your general background. Let's begin with your family.
I'm a single child to my parents. They live in Boston, running family business.
All right. So, where do you live? Do you have another home?
No, I share an apartment with two of my friends.
Okay. Do your friends drink?
Yes, they drink often.
Could you please tell me about your drinking habit?
I enjoy partying at weekends and drink alcohol most weekday evenings.
All right. Do your parents drink too?
No, my parents are teetotalers. And they strongly disapprove my drinking and partying habits.
Oh, I see. Can you just recall when you started drinking alcohol?
I have been a heavy drinker since my late teens.
Your drinking habit is the cause of your current situation. Are you aware of that?
Yes, nurse. I know it. I'm addicted to alcohol. I would like to give up drinking. But, how?
I am really glad to know that you are ready to leave alcohol. Don't get upset. The addiction to alcohol is possible. It is not an impossible thing.
It might be. But, I have to drink daily. I'll start shivering and lose myself if I didn't drink on time.
Alec, stopping the consumption of alcohol can't be done overnight. It's a gradual process. It can only be achieved by reducing the quantity of consumption.
Oh, I see. So, are you saying that it is possible for me too?
Yes, absolutely. You are very young, and if you are willing to control alcohol consumption, definitely, you can come back to your normal life. But, you should be ready to change your habits and lifestyle.
What changes are needed, nurse? Can you please explain me in detail?
First and foremost, avoid circumstances that tempt you to drink. Like, partying every weekend, spending time with friends while they drink, living with people who drink, etc.
Avoiding partying can be done. But, how can I stay away from my friends? We live in the same apartment.
Alec, I acknowledge your situation. But what I suggest you is to shift to another home, or stay with your parents till you get better. Or stop sharing apartment with those who drink and move to another apartment.
Moving to a new place from friends will hurt their emotions.
Convey to your friends that you are moving because of your health condition. It won't hurt them in any sense.
Yes, that's a good idea. That can be done.
Also, you can join the Alcoholics Anonymous group. It is a mutual aid fellowship with the stated purpose of enabling its members to stay sober and help other alcoholics achieve sobriety.
That will be more helpful in this process. I will join the group.
Alec, your optimistic attitude itself shows a good sign of recovery. You should follow the medications without any failure. At the same time, with utmost priority, de-addiction of alcohol should be done.
Thank you, nurse, for your support and advice. I feel much confident now. Definitely, I will follow the instructions.
Thank you, Alec, for sharing the information. If you require any help, please press the bell button on your left side of the bed.
Sure, nurse.
I wish you a speedy recovery. Take care.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.